Hello, today we're talking about overdose trauma care in adults, and our topic is opioids overdose. Some examples of opioids. Opioids can be illegal drugs and also prescription pain medications. Heroin, fentanyl is a synthetic opioid. Oxycodone, some people know Percocet is oxycodone with acetaminophen. Hydrocodone is known as Vicodin. Codeine, morphine, methadone. These substances bind to active opioid receptors in the brain, spinal cord, and other organs and block the pain messages. Opioids are very potent pain relief, but also highly addictive, as they stimulate the pleasure center in the brain, making the person to seek more. Pathophysiology of an overdose. Having more of a substance than the body can handle creates an overdose. Disruption of homeostasis, brain and body damage, excessive effect on the brain portion, controlling breathing. That's a very important point here. Obsessive thoughts, cravings. People who are addicted can't stop thinking and taking opioids. Long-term changes in the brain, increase of neuron sensitivity. Taking opioids and benzodiazepines together can increase the risk for overdose, as both cause sedation and severe respiratory depression. Signs of an addiction. There are many signs people can see if a person is addicted to opioids. For example, this person would spend more time alone, avoiding social activities, sometimes being very tired and sad for no reason, eating more or less as usual than usual, being nervous or cranky, changing moods, and sleeping odd hours. Sometimes people sleep a lot, sometimes they don't sleep at all. Missing work or school, and neglecting personal hygiene. This is very visible, especially if you live with a person, with an addicted person. Diagnosis for overdose. You can see constricted pupils, slow breathing or apnea, like absence of breath, hypotension, psychomotor delays, memory and judgment impairment, chest pain, cold, clammy skin, and unresponsiveness. Also, people will have headaches, neck pain, memory problems, also back pain, and difficulty solving problems. Causes and risk for an overdose. Biological predisposition. That means genetics. If a family member or members are addicted to drugs, that may carry on to the children. People who are depressed and highly anxious, they're more likely seeking drugs. Low self-esteem, poor parental relationships. Children, especially adolescents, may feel isolated and alone and find pleasure in taking drugs. Pleasure-seeking behavior, suicidal ideation, and peer pressure. Nowadays, many adolescents, young people are taking drugs to be cool, and the peers want to blend in. They also start taking these substances. Complications. Many substances have same or similar complications, especially concerning respiratory patterns. Seizure precautions are immediate priority. If a person is confused, has muscle contractions, uncontrolled muscle contractions, wandering, blank staring, chewing, or if a person is on the floor laying down, it is a good sign for seizures. CNS depressants. They have cardiovascular or respiratory depression, coma, shock, seizures, and death. CNS stimulants, respiratory distress, seizures, coma, stroke, and death. Opioids, respiratory depression, seizures, coma, death. Hallucinogens, psychosis, brain damage, hypertensive crisis, respiratory arrest, and also inhalants, damage to the nervous system, and death. As you can see, most of those substances have respiratory depression as a complication. This complication will need immediate attention. Labs and testing. Well, there are 4 different types of testing for opioid overdose. For example, it's urine, which is easy to get, blood, saliva, and hair. In this diagram, you can see different types of opioids and how long they stay in the system. All of them are stay in the. You can see them in the hair after 90 days still, except the fentanyl. Well, this diagram shows therapeutic dose versus overdose. To summarize it, every substance that is in your blood more than 24 hours creates an overdose. A common antidote. The most common antidote for opioids is naloxone or Narcan. It reverses opioid overdose, blocks opioids in the brain. It's an opioid antagonist, counters decreased breathing, and it begins working within 2 minutes if it's IV, and 5 minutes if it's intramuscular injection. You can have a naloxone emergency pen, a nasal spray, or an injectable naloxone vial. Other treatments. If the client is in coma, airway management and gastric lavage are appropriate along with seizure precautions. IV fluids and nutritional supplements are welcome. Low environmental stimuli and anxiety medication, as the person will be very irritated after taking naloxone. Stabilization of cardiac issues, providing comfort, and intensive behavior health promotion. Communication, staying with the person, talking about the problem will help. Some other medications are buprenorphine and methadone. They treat addiction and reverse respiratory depression. Again, buprenorphine and naloxone treat addiction and withdrawal. Especially, it's a drug for. It's a combination of drugs for long-term treatment. And clonidine and naltrexone is causing detoxification. There we go. Long-term addiction treatment. There are many different types of treatments, and every person should find their own group or single therapy. For example, behavioral therapy, support groups, detoxification, pharmacological therapies, as mentioned prior. Removal of peers providing the substance is first thing that every person should do. Just remove yourself from this environment. And milieu therapy, 12 steps programs, family therapy. Nursing diagnosis, risk for injury, ineffective coping, risk for violence, risk for self-harm or others, acute or chronic confusion, and knowledge deficit. Prognosis and prevention. The good way to prevent overdose, any drug overdose, not only opioids, is to lock up medications and chemicals from children. And also for elderly adults, it is advisable to get a pills box, so those medications are taken only at the prescription times. People should recognize signs for addiction, avoid groups that are consuming drugs, drink alcohol in moderation, if not at all, take medication as prescribed, do not double the dose if you forgot one, or do not skip doses, just follow the prescription regime. Discuss the dangers of overdose with adolescents, treat anxiety and depression. That's a big point here, because many depressed people think opioids or other drugs will help to get out of this misery, but it's a myth. It only drives them further into addiction. And also intervenes with suicidal idealization timely. Well, that was it with my mini lecture today. I hope it was interesting and we learned a lot. Thank you.